since entering the global fight against the epidemic in early 2020. COVID-19 has been raging around the world for more than a year, but so far, the world's daily number of new infection cases is still keeping increasing seriously. During transmission, COVID-19 mutated into multiple strains. The transmissibility of Delta variant strain of COVID-19 was significantly enhanced and quickly became the main pathogen of new infection in countries around the world. According to the investigation report from World Health Organization, as of July 20, 2021, the cumulative number of COVID-19 cases in the world has reached 190 million, and the total number of deaths has exceeded 4 million. Except for COVID-19, in recent years, other global large-scale outbreaks of epidemic disease and MERS, SARS, etc. From these epidemics, we can see that most of these highly contagious viruses are airborne and spread widely through the respiratory tract. Once the spread occurs, it is difficult to control in a short time. Respiratory transmission is mainly divided into two types. One is the direct contact transmission of droplet transmission. The other is indirect contact transmission of microbial aerosol. Compared with visible droplet transmission, invisible aerosol transmission is more difficult to prevent and control. Droplet nuclei are aerosols formed from the evaporation of respiratory droplets. The viruses and bacteria it carries can float far away in the form of aerosols, causing long-distance transmission. In hospital-acquired infections, aerosol transmission is always been one of the main causes of infections. Studies have shown that the outbreak of infection in the ICU is directly related to the air in the ward. The air in the infections ward contains certain amounts of bacteria and viruses. Nursing staff and patients are susceptible to infections through respiratory mucosa. Air bacteria content in operating room is positively correlated with incision infection rate. When the concentration of planktonic bacteria in the air reaches 700 CFU per cubic meters to 1,800 CFU per cubic meters, there is an obvious risk of airborne transmission and infection. Air Mobile Air Sterilization Station create a sterile and clean world by sterilizing and purifying the air, care for the health of medical staff and ensure the safety of patients. With its efficient sterilization and purification capabilities, Air has sent batches of equipment to the front lines of China's fight against the epidemic, protecting the breathing safety of medical staff and patients. In addition, Air Mobile Air Sterilization Station is also widely used in hospital departments with high incidence of infection, such as ICU, respiratory department, infection department, hematology, endoscopy center, isolation ward, etc. Its installed hospitals cover 26 provinces and cities in China and has won the praise of many hospitals.